heard why BPA is bad? Hello, my successful and healthy earthlings. Mihaela Raguz here, naturopath and founder of the Natural Health Podcast. In this episode today, you're going to learn all things BPA plastics, why it's bad, and what you can do about it. And at the end of this episode, I'm going to give you an opportunity to join a health and success oriented community by clicking below and joining the Natural Health newsletter. Welcome to the Natural Health Podcast, where we bring awareness of sustainable health in the business hustle space. Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Wednesday, which means it's time for What Would I Do? In today's episode of Natural Health Podcast, we discuss this week's question. All questions are kept confidential and I answer them as if it was me. The information provided is not to be taken as advice and is solely for information purposes only. I'm not here to cure, treat, or provide medical advice. I'm here to educate and inform you so you will take steps towards optimal health. Please discuss any medical issues or health with your healthcare professional. Let's get into today's question. Today's question is such an interesting one, and it goes like this. I've been told to stay away from BPA. Why is BPA bad? What an amazing question. And, out there's so many alternatives there now, like BPA free, and so many things, because so much information light has been shone upon BPA and the effects it has, the negative effects it has on us. But let's first look at what is BPA. BPA is a chemical that is added to many commercial products, including food containers and hygiene products. It was first discovered in the 1890s, but chemists didn't use it until 1950, where they realized that it could be mixed with other compounds to produce strong and resilient plastic. So BPA is a plastic, right? And it's used by a lot of us everywhere around us. So these days, BPA containing plastics are commonly used in food containers, baby bottles, and other products. So let's have a look at where they are used and where common products that it may be found in. BPA has also been used to make epoxy resin, which is spread in the inner lining of canned foods, which is quite interesting. So let's have a look at where BPA can be found. Items packaged in plastic containers, which makes sense because BPA is a plastic. Any canned foods, toiletries, feminine hygiene products, thermal printing receipt. So when you go and get a receipt, when you're going to buy something, it has BPA on it. CDs and DVDs, household electronics, eyeglass lenses, which is so interesting, sports equipment, dental fillings. There are so many exposures to BPA that we're exposed to constantly. However, the main source is through your diet. Because BPA containers are made not all from BPA sealed into the product, these allow parts to break free and mix in the container's content of food or fluids added. So such as cans or anything that might be in plastic containers, you're actually getting the BPA in the food. Just because you take it out of that may not be enough. You actually may be getting it. So the interesting thing is a recent study found that BPA levels in urine decreased by 66% following 3 days, during which participants avoid packaged foods. So I'm always talking about fresh. This is exactly why. Another study had people eating 1 serving of either fresh or canned soups daily for 5 days. Urine levels of BPA were 1,221% higher in those who consumed the canned soup. Absolutely crazy. Another interesting and scary fact is that WHO reported that BPA levels in breastfed babies were up to 8 times lower than those babies fed liquid formula from BPA containing bottles. So babies who are feeding from BPA containing bottles have 8 times more BPA in their body. So exposure to BPA is actually an endocrine disrupting chemical, which was actually identified in 1935 that it was, and later in 1950 it was discovered that BPA could also manufacture plastics. Yes, so the United States Environmental Protection Agency was established a safe level of 50 UG per kilo per day, and the European Food Safety Authority has established a tolerable daily intake below 4. The same as, so the Americans saying 50 is fine, and Europeans are saying below 4. However, data from literature suggests exposure to BPA, even at low doses, may result in adverse health effects, particularly in pregnant women. These include, what does BPA do to our body? Why is it bad? That's your question, right? So this plastic can actually cause endocrine disruption. So disruption to your endocrine system, to your thyroid. Absolutely crazy. It can also affect tumors, adverse reproductive outcomes, transgenerational effects, so many other hormonal issues it can cause. Because the issue with the BPA is that it has an effect similar to estrogen, and it can influence hormonal regulation and activity of estrogen receptors. So BPA may also negatively influence the cell, our female cell maturation, also sperm cell maturation, sperm not cell. And in 2019 review of the research literature suggests that, so this is interesting. So this is BPS, which is the BPA free. So whenever you see BPA free, they use BPS, but a 2019 study actually showed that, which now shows that it has negative effects on reproductive and may cause severe fertility disorders. So even if you see BPA free, it can still cause issues. So yes, your question is about BPA and how it's bad, but I'm here also telling you that BPA free may not be even better, because they use BPS, which is bisphenol S, which could cause even more issues. In humans, they observed high urinary BPA levels and increased serums of the testosterone in girls diagnosed with precocious puberty. In particular, correlation was observed between estrogen metabolism and BPA levels, irrespective of type of puberty and coloration. So this is interesting. It affects females' puberty levels and when they come, which is absolutely crazy. Another one also showed that individuals had higher BPA in their urine who had PCOS. And we know how PCOS affects ovarian failure, infertility, and fibroids, which is crazy to know that something as simple as plastic, BPA, can affect these things. It is also known to cause adverse reproductive outcomes in non-human animals, specifically demonstrated in a HPG axis in mice, rats, and zebrafish. So in a 2018 study found in these aquatic larvae of sea ripless midges, the general transcriptional profile of several genes were affected after 24-hour exposure to BPS, which is the BPA-free alternative, especially involved in the endocrine pathway. This is crazy because this is suggesting that BPS activates the transcription of genes encoding nuclear receptors. So essentially, this is saying that it can affect our genes. Not our genes, but the genes of zebrafish, mice and rats. But we have studies showing what BPA does to the endocrine system, especially the female reproductive system, and also sperm and reproductive health, but also what BPS can do for our health. To answer your question, that's kind of why it's bad, because it's affecting us overall. But the question is what do you currently use that has BPA now or is BPA free? What are you currently using? Where is plastic mainly found in your diet or in your life? What's plastic in your home? Can you switch it for glass? Do you need to use the plastic? Are you heating things up in a plastic container? Are you eating a lot of canned stuff? This is the question you need to ask yourself. What would I do? I would avoid BPA. I would even avoid BPA-free products. Whatever I would want to drink or eat out of would have to be out of glass. If I want to heat up a product, it'd be on the stove or in glass. If I want to eat out of a product, it would be fresh and natural. I know sometimes we can't avoid these things, but I would try and reduce my exposure as much as possible. First, identifying where I use it the most, right? Where I use it the most, and then try and reduce it there. So for example, if you're now drinking out of water bottles, try drinking out of glass bottles. That's a huge saver already. If you have kids and if you're using bottles, try and do something different, not plastic. There's so many other alternatives out there now that we can use, and we're so blessed that we're able to use alternatives. So there you have it. I hope that I shed some light to why BPA may be bad for you, and I hope that you share this episode with someone that is using a lot of plastic in their life at the moment and get a bit of a wake-up call, and maybe you'll be able to save their health, save their endocrine system, save their reproductive health. So there you have it. Do what you do best. Love, like, share the Natural Health Podcast, and remember, if you want to join a health and success oriented community, click below and join a Natural Health newsletter. Specials and bonus sent straight into your inbox every Friday. How amazing is that, right? And thank you so much for joining us on Natural Health Podcast. And remember, the missing link between failure and success is your health. content and information provided here is opinion of Mihaela Raguz and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mihaela Raguz does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Health Podcast, Mihaela Raguz, any guests or contributors to the Natural Health Podcast, or any employees, associates, or affiliates of Mihaela Raguz be responsible for damages arising from the information provided on the Natural Health Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Health Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mihaela Raguz nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.